So we need to discuss for the double line series. So double line series, what it is, it will come in that. Everyone having notes with you, right, guys? Double line series notes you have or not? Okay. So double line series, it is the evaluation and management. From this, in your exam, 6 questions it will come. So evaluation means testing, assessing, or examining the patient. Testing, assessing, or examining the patient. That is the evaluation. Okay. Once checked, after that, they are concluding the what condition, what impression patient having. Correct. So based on that, they are giving the treatment. So the treatment is called management. So first they are checking, assessing, examining the patient. That is for the evaluation. After that, what concluding the impression for that, taking the giving the treatment. The treatment is called management. So evaluation means testing, assessing, examining the patient. Management means treatments. So evaluation and management. From this, you will get 6 questions. In starting of the first now we have some changes in the evaluation management. In previously, what basis selected means not only time. Now it is changed, but before in starting period, if that patient seeing the sorry doctor seeing the any patient, doctor seeing the any patient in that patient medical record, in that patient medical record, MD should document some informations. That's 7 components. So what are all 7 components need to document in the every patient mean history, exam, MDM, time, counseling, coordination of care, nature of presenting problem. Please look these 7 components. So evaluation means checking, assessing or examining the patient. Management means treatment options. So that is the evaluation and management. So in the starting period, I said provider want to see the any patient in that every patient medical record. They have to document history, exam, MDM, time, counseling, coordination of care, nature of presenting problem. So in these three, in these seven, first three we called key components. It is not in now. I'm telling in the past how we followed. I'm telling. So history, exam, MDM, these three called key components. Remaining all it is non-key components. Okay. So this only we followed in past before year, not this year, last year, before year and all we followed in that seven component basis only. But now as per new 2023, they are telling we need to go with the based on only MDM or time. This two component basis. This is 2023 we are following. So MDM or time basis. These two basis only you need to select. Either you can go for the MDM or time. You need to go for MDM or time. In the two basis only you need to take the evaluation management course as per 2023. Okay, this is very important thing you need to know. As per 2023 we are following the either MDM or time basis. So history and exam and all appropriate any one history what purpose patient coming, that is enough. And physical examination any one system they are examined, that is enough. So history who will give, anyone know about that history part? Who will give?
Patient.
Correct, correct. Patient. Patient only will give the history. What all he is feeling, he will tell. What all he is facing the problems. Correct. That is for the history. Then exam. Exam who will give? Anyone know about exam who will give? Physical examination who will do?
Physician. MD.
Correct. Physician only will do the physical examination. So history part patient is giving. Examination physician will touch the patient physically, then what he got findings he will give. That is for the physical examination. Then MDM, anyone know who will give? MDM what basis we need to select? MDM means what is the full form? MDM, what is the full form?
Medical decision making.
Yes, MDM full form is medical decision making. Medical decision making. That is the MDM. So this MDM is what diagnosis present and what treatment giving. What is the risk? Based on that, we are taking the MDM. So MDM we have detailed class. Okay, that I will explain. So MDM, medical decision making. So that MDM only now very important as per 2023 concept. We are going with that MDM only. So we need to go for the in last year and all we have history exam MDM. Okay. But now we need to go for the based on the uh, only MDM or time basis. This is the 2023 concept. So what are all visits we have in 2023? What are all visits we have? We need to know that. So based on the place of service, that service happen in this which place. Based on that, we have the codes. Encounters, emergency department, hospital, inpatient, observation, consultation, nursing facility, home or residence, rest home, prolonged service, office or other outpatient services, preventive service, critical care. These all are the encounter names. Encounter names. That is based on what? As per 2023 MDM only. Inpatient MDM or time. So these observation codes are deleted. They are telling instead of that, they are telling to use the hospital inpatient code. And consultation MDM or time. Nursing facility, home residence. And this is they are telling domiciliary and rest home. These codes are deleted. They are telling to use the home service code. And prolonged service based on MDMR time, office or other outpatient service, MDMR time, preventive visits, patient age and payer, and critical care based on the time. You can make it shortly note of this. Okay. So as per 2023 ENM based on what basis? What concept? Everyone.
MDM on time.
Very good. Please don't forget. It's very important. We need to go for the MDM or time basis. So now I'm going to tell about the how to select the MDM. How to select the MDM. So please make it note of this MDM. Everyone, please write these points. So MDM is the process which a diagnosis or treatment plan formulated from the available medical information, often with the incorporation known patient preference. So this is the MDM. And MDM is we have three elements based on the number and complexity of problems to be addressed during the encounter. Current encounter, how many problems present they are addressing based on that. Second one, complexity of data to be reviewed. Complexity of data to be reviewed. And third one, risk basis. So we have these three element basis. We need to select the MDM. Okay. So MDM is we have the three tables, right? So this is the A table, number of problems to be addressed. Then complexity of data, it is the B table, and risk is the C table. So in these three tables, any two tables should satisfy. Clearly mentioned, you qualify for the particular level of MDM, two of the three elements. So in these three A, B, C, in that any two, that means 2 by 3. Three table, any two table met now, can go for the MDM selection. Okay, that is it MDM. And we have four types of MDM: straightforward, low, moderate, high. So straightforward, low, moderate, high. And this MDM concept not applicable for 211, 281. Okay, so please write it first, everyone. Please write MDM. You can keep heading. Under you can write this.
कोणाच्या बायकोला मेडिकल मध्ये काम पाहिजे काय शिकले ती मेडिकल मध्ये कसं भेटेल तिला ती आता 14वी शिकते
Guys, noted. Please inform to me. So what are all MDMs we have? Levels of MDMs, what are all? Levels of MDM. Guys, please respond. What are all levels of MDM we have?
Straightforward, low, moderate, and high.
Yes. Straightforward, low, moderate, high. So this is the hierarchy. So MDM hierarchy is least one is straightforward, highest one is high. So straightforward, low, moderate, high. Straightforward, low, moderate, high. So in this, how to select? I said, so based on the A table is number and complexity of problem to be addressed. they encounter how many problems they're given, na? That is the A table. Then what all they are doing? Complexity means diagnostic studies or any additional workups, it will come. And risk, that problem is how much severe, that is the risk. So in this three table, A table, B table, in that C table, there any two tables satisfying, you can go with the MDM, final MDM. Suppose if I'm telling A table low before that, so 2 by 3 mean this three table, any two tables should satisfy. So how to select 2 by 3 means 2 by 3 means how to select the least one, not least one. 2 by 3 mean how to select the middle one or which is having two times. Please make it note. 2 by 3 means 2 by 3 mean how to select middle one or which is having two times. So 2 by 3 mean how to select the middle one or which is having two times. Example, A table. A table is low. Okay. B table moderate. As per your medical record, you are searching, you are getting A table low, B table moderate, risk is high. In this, what is your final MDM? So 2 by 3 mean middle one or which is having two times. Middle one means in that hierarchical, suppose you are getting straightforward, low, moderate, na, in that hierarchical, middle one is low. Or example, if in this example, I given low, moderate, high. So low, moderate, high. So in this three we got, then what is your selection? 2 by 3 means low, moderate, high is the hierarchy, right? So in this 2 by 3, na, middle one is hierarchical, middle one is moderate. Suppose if I'm asking for A table, A table is low, B table is high, C table also high. Now what is that final MDM? Low, high, high.
High.
So which one having two times? So high we have two times. So high. One more example. A table is moderate, B table is low, C table is high. Moderate, low, high. You got A table moderate, B table low, C table high. Now what is the answer?
Moderate.
So here we got the hierarchy only you have to check, not for the what A table, B table, not in that middle one. So you got low and moderate and high. So low, moderate, high you are getting. Moderate. Okay, so moderate is the final MDM. Everyone understood? So A table
Hello.
is yes.
Sir, if straightforward, low and moderate, then low will
Okay.
be middle
You
one,
are
right?
telling straightforward, low,
Moderate.
moderate. Yes, low
Huh.
is the middle one.
Okay, okay. Thank you
In
so
that
much.
hierarchy only, not in the A table, B table, in that middle one. I'm telling
Okay,
what
okay.
you are getting the MDM.
Hierarchical middle one. We
Yes,
have to
correct.
select.
And that
Yes.
hierarchical middle one.
Okay, okay, okay. Thank you.
Suppose straightforward, moderate, high. Now, straightforward, moderate, high.
Moderate.
Yes.
Moderate.
Moderate. Good. Okay. Next, now come to the MDM table. Everyone can take the book, PPT book. In that, can turn the pages. Say the CPT book. Okay. So you can turn the pages starting of the CPT book. After the prefix suffix, that body planes, we have the visits name and code sets. Visits name and code sets. So this one I will explain later. Now you can go with that page number 8 or 9. 8, 8 and 9. 8th page number. Everyone, please go there. Okay, you can go there in the page number of 8th page number. CPT book, page number 8. In that, mention elements of the medical decision making. So I said 3 elements. So elements, one is for the number and complexity of data to be number of problems addressed, A table. Then amount or complexity of data to be reviewed. This is the B table. Then third table is risk. So number and complexity of problem addressed, one. Second one, complexity of data to be reviewed. Third one is risk. We have these 3 tables. Okay, that 3 table basis we have to select. Straightforward. When we have to take first straightforward means, if A table is minimal or B table minimal, risk table minimal risk, na, then you can go for straightforward MDM. So minimal is one self-limited or minor problem. One self-limited or minor problem means for this condition, no need medical attention to doctors. Without seeing doctor, that problem it will cure automatically. That is for the minimal. No need medical attention to doctors. So that is for the minimal. So amount and complexity of data to be reviewed. In that nothing is there. None given, you can go for the minimal. That means straightforward. Risk also same like. Okay, straightforward is based on the self-limited or minor problem, or in B table nothing is there, and risk table minimal risk. Then low. So straightforward is mostly a rare scenario. Then low points. Under low, given the two or more self-limited or minor problem. One self-limited, it is straightforward. Two self-limited, it is for low. Two self-limited or two minor problem, it is for low. And one stable chronic illness. What about the chronic illness? Anyone tell about what is the chronic condition? So chronic means lifelong, long time that person having. That is a chronic. So like hypertension, DM, COPD, asthma, that chronic conditions given. Now status is mild, controlled, stable. Mild, controlled, stable given. Then you have to go for this point on stable chronic illness. So what is mean by acute illness? Acute means what? Chronic, na lifelong,
Sudden
long,
onset.
suddenly, currently, now only started. Short term. Okay. So an acute uncomplicated illness. Now only started one problem. It is not complicating one or injury or illness. Then it is for the low. Two or more self-limited, one chronic condition stable, one acute condition uncomplicated illness injury. So two or more self-limited, one stable chronic illness, one acute complicated illness, uncomplicated illness, and one stable acute illness. Same point. One stable acute, one chronic, one problem started, but now it is stable, not worsening or something. Then it is for the low. One acute uncomplicated illness, injury, recurring inpatient or observation level of care. Maybe you're having the head injury. Head injury is the minor rash, sorry, minor crack, minor skin tear only happen. For that, I think no need much treatment, right? But they have some doubts. Maybe inside the skull, if he got any hemorrhage or something. So we need to observe that person some hours. Then only we can conclude. So that is the one acute uncomplicated illness injury requiring hospital inpatient or observation level of care. Okay. So in this any one point, we have the in this 1, 2, 3, 4, 5. So in this 5, anything is warrant, anything is present, then as per A table, it is for low. Okay. So everyone clear with this? Low points under the A table. Next, we have the B table. Under limited, when you have to go. Limited means it's a low final level MDM. So limited when we need to go. Please read this. Must meet the requirement of at least one out of two categories. So here category 1 and category 2 given, in that any one met. Okay. Please read once this category 1 and 2. I will explain. So category 1 and 2. So category 1, test and documents. Any combination of the two from the following. So we have 3 bullets. In that any 2 bullets present, category 1 warrant. That is the meaning. Category 1 is, so 2 bullet is there. Okay, in that any 1 bullet, any category 1 and 2, in that any 1 category met na, can go for the low. Under category 1, 3 bullet present. In that any 2 bullet, then only category 1 warrant. So review of the prior external notes. Review of the prior external notes. Each source. Review of prior external notes. That means they are reviewing the past informations, treatments, everything for the patient, but not here. Some other hospital records. Prior external notes. That is the one point. Another one, review. Already having the reports or in that current encounter ordered, they are going to review that. So review of the test results. Either lab, radiology, X-ray, CT, MRI, MRA, ultrasound, EKG, like that. So in that anything they are reviewing, review of the results, each unique test. That meaning is how many reviews they are doing, each one point. That is the meaning of the each unique test. Each test one time you have to consider. Okay, that is the review. Order. Order mean in that current visit they are going to perform newly one thing. That is the order. In current encounter, newly going to order. So either review of the prior external records or review of the test results or order of the test results are going to perform newly one thing. So in this review point or review of the external records and order, in this 3, any 2 bullets warrant present, category 1. Okay, review of the CT report, external report 1. Okay, and in current encounter going to order X-ray. Now category 1 warrant or not. So CT of the review of the external in old prayer records while checking in the CT report seeing, and in the current encounter going to order the X-ray. So as per these 3, 2 bullets warrant, correct? That means first bullet and third bullet. So any combination of 2. So that means category 1 warrant. Then category 2 is assessment requiring independent interpretation of the test in discussion. So independently historian. That means apart from the person, anyone given history, patient, family members, that is given or providers get, someone is given apart from that patient, then you have to go for the low. Okay. So category 2 warrant, that is the meaning. So either category 1 means under 2 bullets, category 2 is directly 1 point. Okay, assessment requiring independent historian. Okay, so in this two category 1 or 2, any one met, because must meet the requirement of at least one out of two categories. Suppose I'm telling order itself CBC and CMP. I'm asking for question is order of the CBC CMP. What is your this is enough to go for category 1 or not?
Not enough, sir.
Okay, I'm asked for the order of the CBC, order of the CMP, category 1 warranting or not?
Not warranting, sir.
Why you are saying like that it's not warranting? I'm telling it's warrant. Why means uh, here clearly stating
It must meet the requirement of at least one out of two categories. No? So warranting.
category 1. I'm telling category 1 under how many things you need? Any combination of two from the following. Any combination. Any combination. Each unique test, that is also one point. So under order itself, we have the CBC one and CMP one. So two bullets warrant. Okay. So two bullets warrant. So any combination, either order itself or review itself or review of prayer external notes itself, two points, or review one, order one. That also you can go for the category one. Everyone understood? I'm telling each point one or under single point two, order itself two, or review itself two. Guys, you understood or not? I'm telling for the review of prayer records 1 point, order 1 point, review of test results 1 point. That also you can consider. Or in single point itself, below two things is there. So order itself two, or review itself two. Review of the external notes in that itself two things is present. Na? That time also you can go for the so. Okay. Guys, I explained you clear or not? No. Okay. So now, moderate points. Under moderate, first table, A table, one or more chronic illness with exacerbation. That chronic illness table means what is the MDM? Chronic illness table means what is the MDM? Chronic illness table.
Low.
So,
Low. That chronic illness today is worsening, severe, uncontrolled. That chronic condition today is worsening, severe, uncontrolled. That chronic conditions today is severe, worsening, uncontrolled. Then it is for the moderate. Because that chronic condition today is exacerbation. Or two chronic conditions stable. One chronic condition stable, low. One chronic condition worsening, it is moderate. Two chronic conditions stable, that time also it's moderate. That time it's moderate. And one undiagnosed new problem with uncertain prognosis. Patient having their chest pain, abdominal pain, but not concluded what is the final impression. Why? Why? What is the reason chest pain came? They're not documented. They're telling only chest pain. One undiagnosed now having problem that symptom, but it is undiagnosed one. One undiagnosed new problem with uncertain prognosis. We don't know because of what reason it came. That is the uncertain prognosis. Mostly they're telling about the chest pain, abdominal pain and all. One undiagnosed new problem with uncertain prognosis. Then one acute illness with systemic symptoms. One acute illness with systemic symptoms. So systemic related, uh, like pyelonephritis, gastritis, systemic related problems. All ITs, most of the conditions, it is coming under the moderate. Systemic related, systems related problems. Okay. So one acute currently started, it's related to the system, cardiovascular, GA, GU, like that. Okay, all ITs mostly it will come under moderate. And one acute complicated injury. But previously I said head injury alone. But now I'm telling head injury with loss of consciousness. So you understood what is the complicating? Head injury is present, nothing is there. No, it's a low. But the head injury having now patient having the loss of consciousness, then it is complicated one. So an acute complicated injury. Okay, so everyone understood this moderate points under A table. Okay, so please tell, you need to know clearly in this anything you are doubt. You understood, right, guys? Can I move the next B table? Then B table, we have the category 1, 2, 3 categories present. Category 1, 2, 3. So in this 3 category, how many categories they have to meet? At least 1 out of 3. So in this 3, any 1. 3 category, 1 out of 3. Any one. Three categories present, right? In that any one. So first one is any combination of three from the following. So review of prior external notes, review of the test results, order of the test results. That assessment requiring independent study, they added in the category one. So in this four, any three present, it is for category one, warranting, moderate. So if I'm telling for the CT order, CMP order, then EKG order, all are order. CT order, CMP order, EKG order. Please tell the answer. It is warranting what? Any category. Very good. Category one warrant. I said any combination, either review one, order one, or review of the test results one, or review of the prayer records, or any single pawn itself below itself. Order itself 3 we have. Correct. That is the meaning, right? So order itself 3. So that time also you can go for the category 1 warrant. So any combination. So it is the moderate. Okay. Because 1 out of 3. 3 categories, any one met, na, it's the moderate. Then category 2, independent interpretation of the test. So you are visiting the hospital or clinic, MD ordering the test X-ray. They can be using the hospital equipment used. After that, that provider will look the film independently. Is not saying this someone interpretation. He looked the film independently. What he is seeing in that is writing the summarization. Or is writing the results of that EKG independently interpreted by me. It was showing normal sinus rhythm. CT interpreted by me. It was showing no acute process. Like that, provider given own interpretations after seeing the film is giving. That is the category 2, independently interpreted. Okay. Then case discussed with the other healthcare provider, discussion of management or test results, test interpretation. So one physician discussing with the other doctors. So regarding the condition, one doctor discussing with the other specialist doctor. He is telling my patient having this problem. So what we can do? So other doctor he will tell, he will do something. Okay, you can admit the patient, give more fluids, antibiotic and all you can give, then you can discharge. Like that, one provider asking the other doctor, that other doctor what he conveyed, what he recommended, that is summarized. I discussed with the A doctor, B doctor. He is telling to give this fluid or admit the patient. So that is the case discussed with the other healthcare provider. Discussion management test interpretation. Discussion of management test interpretation with the other external physician. That is for category 3. Category 2 is they will tell either the test results or EKG, cardiac monitor, EKG, ultrasound, CT, MRI, that one, or any sample, lab pathology sample taken. So that is the who will give. Generally, you are going one clinic, in that nearby they will refer one diagnosis center. You are going and taking the X-ray. X-ray that you are collecting and coming back and showing to the provider. Provider is collected and he is looking the film independently. What he is seeing in the film, he is writing the summarization, own interpretation. It is not the technician, pathologist results or computer generated report. Providers look to the film independently. After that, what he is seeing in that is writing the summarization. He is writing the results of that. Independently interpreted. Mostly the word they will give clearly in some point of view. Okay. So 3 categories. Any one category met? What is that? There are 3 categories present. In the any one category met, what is the MDM? Very good. 3 categories. Any one category met, it is for 1 out of 3. It is for moderate. So in the 3 categories, any 2 category met? In this 3 category, inside the book, check correctly and tell. 3 categories present. In the 2 categories met?
High.
Good. High. In the 3 categories, any one met na, it's moderate. 3 categories, any 2 met na, it is for high. Okay, good. Okay. So this is the moderate points. Under some risk they given. So prescription, under risk they given for the prescription. Most of the ENM chart they will give clearly prescription. Most of the chart they will provide the prescription. So prescription given, you can go for the moderate. So prescription mean as per doctor advice only we need to take the drugs. Without medical advice from the doctor should not take. As per doctor advice only we need to take the drugs, medications. That is the prescription. So if it is OTC now, anyone know about OTC, over the counter drugs? OTC mean no need medical advice from the doctor. Without doctor advice we can take. That is the OTC, over the counter drugs. So one drug given now, it is the prescription or OTC we need to know. Okay, you are searching in Google, you are trying some website, drugs.com and all. You will get the drug is prescribed drug or non-prescribed. That means OTC you will come. So whatever present in the moderate, that points not met, moderate under 4 to 5 points present, right? That is not met, then default is low. Moderate points prescription and minor surgery with risk. Minor surgery with risk. They are going to do one surgery like eye operation they are doing. But patient having the hypertension, DM, that chronic conditions. Because it is critical only, right? With because we are keeping the BPs normal only can able to do the surgery. So decision regarding minor surgery. They are planning for minor surgery with identified risk is there. The identified risk present. Morbidity means that comorbids only they are telling. So you are asking for mortality means number of deaths. So because of that disease, how many death happening? They will take some surveys, right? That is the mortality. So while coming with the moderate points, prescription is present. You can go for the moderate. And decision regarding minor surgery with risk present, it is moderate. They are planning to do on major surgery but no risk. Decision regarding elective major surgery but no risk. That is moderate. And diagnostic treatment significantly limited by the social determination of the health. Doctors or that healthcare providers not able to give proper treatment, to can't able to find out the diagnosis because of some other complications. Maybe say maybe patient having some other reasons. Because of that, this one not able to do. Okay, this is a rare scenario. Definitely it won't come. No need of this. But important is prescription. You can remember prescription present, moderate. Minor surgery with the risk, moderate. Only major surgery, then it is moderate. Okay, these points you can remember. These all are the moderate points. So moderate points not made default, you can go for the low. Moderate points you are checking that is not warranting, then you can go for the low. Then high risk, high points. So it is the life-threatening conditions, this chronic condition. Now it is worsening. It is threat to the life. One or more chronic illness, severe exacerbation. It is severe become sepsis, septic shock, COPD, severe asthma, severe that and all. Acute respiratory failure, acute conditions. All failures, acute respiratory failure, heart failure. That acute failures also can go for the high. So in these points, as per A table, it is going the high. Okay. Then B table. Already we discussed the B table. In that three categories, any two category met. Two out of three categories. One out of three mean it is the moderate. Two out of three mean it is for high. Okay. Then high risk. High risk under drug therapy requiring intensive monitoring. So they are going to give one treatment to the patient by using the drug. The drug they will monitor. If you are first they will some hours they will monitor. They will administer the drug. They will monitor the patient. If the patient have got any other problems, side effects or toxicity, any allergic reactions or not, they will monitor. Then they will use the drugs. That is for the drug therapy requiring intensive monitoring for toxicity. So please read the other points, other bullets, please read once. Okay, so they are planning for the major surgery with risk. Elective major surgery with risk, na, it is the high. Only they are planning for emergency major procedure. So planning major surgery with risk, na, high. They are doing for emergency major procedure, that time you can go high. Then decision regarding hospitalization. Patient came into outpatient setting, that patient admitting into the inpatient hospital, inpatient setting, or transferring one hospital to other hospital, that is for the high. And decision to resuscitate, DNR, they will mention in the patient medical record DNR status. Yes, given na, you can go for the high. Do not resuscitate. So the patient coming for cardiac arrest, that time MD asking the to the patients, sorry, family members, we need to give the CPR or not. They have rights to select the okay proceed or not. So because maybe some family members, they are telling so no need to do anything, as it is leave it, because he is a aged person. We are giving treatment also, he won't live. So that they are thinking like that. They are telling you don't give any treatment, as it is leave it. So that is the DNR. So do not resuscitate. Status given yes no, then it is for the high DNR. Then parenteral control substance. So the drug dosage is limited by the government. You can't take more than limited, right? What they are permitting, that only can use. That is the parenteral control drugs. Parenteral control drugs given through IV or IM, your risk will be high. So you have the PCD list with you. I shared PDF. If not, now I'm shared again. In this list, whatever drugs present, that drugs given through IV or IM, your risk will be high. So here given the number of drugs, many drugs given list. So these substances, these drugs given through IV or IM, your risk will be high. Your risk will be high. Okay, please go through this. So whatever drugs present in this list, that drugs given through IV or IM. Please remember intravenous and intramuscular. Then it is your risk will be high. Okay. So please go through these points. Straightforward, low, moderate, high points based on the A table, B table, and risk table.
Hello,
Yes, yes.
sir. Is there this PCD list in book?
No, no, no. It's not present.
Okay.
It's not present. Okay. So now I'm giving the example. You can take for the what is the based on the tables, MDM table. You can select the answer. What MDM only I want. Please give the answer quickly. Only 4 questions. Give the answer. Okay. So minimal minor problem with minor risk. Minor problem with minor risk. So it is for the straightforward. Minor. So A table minor, risk table minor. So straightforward. Second question, it is for the hypertension stable. It is for low. Risk is low. So low is the MDM. Then DM hypertension stable. It is for the moderate. And prescription is moderate. So moderate. And acute respiratory failure, it is for the high. And admitted to the hospital regarding hospitalization high. So high. So straightforward, low, moderate, high. Okay. So everyone is clear? Okay. So,
Hello,
Yes.
sir. Last one, where that point is admitted to hospital.
Regarding hospitalization, in a site, in high, under, you can check regarding hospitalization.
Okay. Yes, decision regarding hospitalization.
Yes.
Yes, yes.
Okay.
Thank you, sir.
Okay, guys. Today this much only. We are continuation.